Oral local anesthesia faced with two major risks. One is a too quick injection, the other is overdose. These two risks cause medical accidents every year all over the world. The emergence of the oral analgesia local anesthesia boosting instrument solved the two major risks. The characteristics of the two products are open-type operation, constant and slow-speed anesthetic injecting, combined injection and inserting needle. The new design not only provides convenience for clinicians to provide local anesthesia, but also let the patients enjoy the comfortable feeling of anesthesia. Common anesthetic methods: block anesthesia, infiltration anesthesia, perisegmentum anesthesia. Oral anesthesia is accompanied by the risks of hematoma, injection area pain, facial paralysis, infection, nerve injury, local tissue necrosis, so that most dentists do not use this method. Now let me introduce how to use local anesthesia boosting instrument to achieve oral painless anesthesia. Painless local anesthetic techniques: psychotherapy, pre-anesthesia, using equipment. Psychotherapy. It can ease the tension of the patient to communicate with the patient, establishing trust. Dentists with rich experience are bright with accuracy, attention to detail. Patients. The idea for painless treatment should be carried out from beginning to the end. Pre-anesthesia. Pre-anesthesia reduces the puncture sensation of local anesthesia from the start of inserting needle. Using equipment. Using local anesthesia instrument, we can achieve delivering anesthetic in slow and constant speed. Inject anesthetic while pushing needle. Form anesthesia channels. Reduce pain of patients. First, stick the tip of needle on the mucous membrane. Press the sterile cotton swab on the needle. Push anesthetic for about 4 seconds in low speed. At this time, the cotton swabs stand with anesthetic. The cotton swab form make mucosal surface anesthesia. Then punctured mucosa of 2 mm gently. Continue to push anesthetic for 4 seconds. The needle move forward 1 mm and continue to push anesthetic for 4 seconds until the needle slip attached to the periosteum. Continue to push anesthetic to the required amount. After wait 6 seconds, pulling out the needle. Avoid the liquid spray out. Local infiltration anesthesia suitable for 1 to 2 teeth anesthesia or a small range of tissue anesthesia. Infiltration anesthesia is the most simple and safe method of local anesthesia. Area for infiltration anesthesia: anesthetized teeth, the teeth near injection position, dental periphery, and soft tissue. Check on the root length and dental inclination. Assess crown-root ratio, which can help decide the best puncture position and injection position of infiltration anesthesia. Puncture position of infiltration anesthesia. Turning point of lip and buccal mucosa close to the root. Most of the mucosal position covered by maxillary root surface. Palpable bunny projections. Bunny projections are visual signs for tooth long axis and the signs of a puncture point of tooth root orientation. Injection position of infiltration anesthesia. Inject the drug in the position of a tooth root and slightly lean to the root. Avoid contact with the bone tissue to reduce discomfort. Injection of a periodontal membrane. The only anesthetic technique without risk of enter blood. Single roted teeth. Injection for ones. Entry needle point. Far middle buccal or lingual angle. Multi-roted teeth. Injected twice. Entry needle point. First far distal buccal site, then mesial buccal. Injection volume, pre-Machin, lingual and buccal of the anesthetized tooth turn white. Injection angle. Needle slope toward the root. Injection needle and tooth line axis is 30 to 45 degrees. Enter the periodontal ligament gently, like using a periodontal probe. Insert needle very slowly until encounter resistance. Contraindication. Patients with active periodontitis were prohibited from injection.